Hi there, my name is Louise Norris and I write about healthcare reform for healthinsurance.org. And since it's the holiday season, my fellow writers and I have teamed up to write a letter to Santa, or in this case, a letter to Hanukkah Harry, asking for some improvements and some changes to healthcare reform and to the Affordable Care Act to make health insurance and healthcare more affordable and more accessible to more Americans. And so today I am with Charles Gaba, who is a web designer by trade, but he's also the founder of ACAsignups.net, which has been a go-to resource for me over the last year and has generated a ton of media interest. He's been cited in the Washington Post, Forbes, New York Times, widely regarded as the most accurate source for up-to-date ACA enrollment data. So with that, welcome Charles, and what would you like from Hanukkah Harry this year?
Well, thank you. Well, yes, so, as you noted, I'm sort of the numbers guy, sort of the bean counter of the group here, and my big focus, of course, is on the actual enrollment numbers across the various state exchanges as well as HealthCare.gov. And so what I'd like from Hanukkah Harry this year, or going forward, would be, I know that recently HealthCare.gov has finally started issuing weekly snapshot reports that have given sort of a total number of plan selections and so on. I'd like to see those weekly snapshots. Well, that's a very good start. I'd like to see those broken out by state if possible on a weekly basis. And in particular, and this applies to all of the state exchanges and healthcare.gov, I'd like some consistency in the actual reporting methodology. For example, some of the state exchanges are reporting new enrollees and renewals as a single number. Some of them are breaking them out. Some are only including one or the other. Some are including Medicaid and CHIP enrollment figures. Some aren't. Some are mixing those together with the private policies. Some of them don't report Medicaid at all. Some of them have been releasing enrollment reports daily, like Massachusetts. Some have been doing it weekly, like Minnesota. Some are doing it monthly, like Colorado and some other states. Some haven't. Some do them pretty much whenever they feel like it, which could be every couple of days, or it could be every couple of months, or not at all. So I'd like some consistency on that, if possible. And if I think daily might be pushing it, but weekly it seems pretty reasonable to me. Ideally, I'd like them, all of the exchanges, to release their data on the same day each week, so that there's consistency in terms of what you're comparing the numbers against. For example, this last weekend, which is the big December surge, there's a big difference between a number that comes out on Friday and one that comes out on Sunday or Monday. And finally, I'd also love it, and this is more of a general purpose thing for the entire Health and Human Services Department and all of the state health departments. I'd love it if you could standardize your terminology, in particular when it comes to Medicaid. I did not know until about a year ago when I started this that Medicaid has a different name in every state.
Yeah.
And a lot of people don't know, like I didn't, that Mass Health in Massachusetts is Medicaid, or Medi-Cal is Medicaid, or whatever, Green Mountain Health, or whatever they call it in different states. A lot of people don't know that that's when politicians are talking about that, they're talking about Medicaid, and they think that they're talking about some other program. So I think that's important. It would be nice if they all called it Medicaid, which they probably won't, or at the very least, if they included a parenthetical reference, Medicaid, anytime they're talking about the program under the state's name. And I think that's about it.
I think that all sounds excellent. More standardization, more transparency, be perfect. If Hanukkah Harry is feeling especially generous, it would also be great if we had some standardization for reporting from carriers in terms of off-exchange enrollments.
Yes,
I
thank you.
think
That
that
would
would
be
be
very helpful.
great for,
Yeah.
just for getting a concise picture of how the uninsured rate is falling, and, it would be
Not,
good to
oh,
keep
and I
track of.
almost forgot. Don't forget the shop enrollments. I know they're
Oh,
small
yeah,
right now. Shop enrollments would be nice
absolutely.
as well.
Well, excellent requests, Charles, and hopefully Hanukkah Harry will come through for us. So,
Great.
all right. Thank you. Great talking with you.
Likewise. Happy